I wanted to start off with a massive thank you to all our members from the NPA board and from our team. We know quite how much you're doing to help the nation cope with coronavirus. And we can hear that and we can see it, quite how intense that pressure is at the moment. I want to reassure you that we're doing all that we can to help you at this time. We're taking hundreds of telephone calls every day from members needing and wanting the latest advice. And of course, don't forget, we also open on Saturday mornings as well as during the week. And next week on Friday, Good Friday and Easter Monday, if you're open providing pharmacy services, we'll be open providing helpline support for you as usual. And of course, I want to remind you that with all the new challenges that coronavirus has thrown up, there are plenty of HR issues. As NPA members, you've access to our free of charge employment law advice service. Just use it. I also know that our insurance team, the NPAI, is going out of its way to accommodate your needs in this rapidly evolving situation. They're also involved in advising government on all the issues around professional indemnity insurance, around volunteers, around staff from pharmacies working in other pharmacies, etc. And of course, we ourselves are also in constant dialogue with government, the NHS and regulators, and making sure we tell your story in the media. Our main message to the public right now is that you're serving the country with huge courage and professionalism, but that your stamina and your resources are not inexhaustible. You need customers and patients to be considerate to you and to each other, which of course includes not entering a pharmacy if you have coronavirus. You may have seen in recent days some of the fantastic coverage we've generated, whether that's BBC News, ITV News, The Adam Bolton Show on Sky, Sky News, Radio 4, LBC, and many, many more. And of course, we know you need more help from government too. Urgent help that will help you to continue to help others. I'm really pleased to say this has started now in each country of the UK, but much more needs to happen to keep the show on the road. We expect and hope that there will be further announcements shortly. And can I just say a big thank you to all of you who've helped us so far this week collect data on the very real extra costs of COVID. And if you haven't had a chance to do that yet, please just give us a few minutes of your time to fill in the survey. I'm really pleased to say that over the last couple of weeks, we've also seen community pharmacy begin to be recognised by more and more people. We managed to have Matt Hancock, Secretary of State, record a couple of videos, Boris Johnson, the Prime Minister, to have a shout out in one of his bulletins, and Nicola Sturgeon, the First Minister in Scotland, was tweeting about the role of community pharmacy. I believe Piers Morgan has just weighed in with a tweet as well. And of course, there are many, many more people who are recognising the role that you're playing. I want to finish by reading you now just a couple of paragraphs from the most recent letter we received from Matt Hancock. We were raising the need for recognition and appropriate funding to cover the very real costs of COVID. So Matt said, we're in the midst of a huge national effort to fight coronavirus, and your staff are well and truly on the front line. I've been moved by the stories that I've heard over the past few weeks of pharmacy staff looking out for vulnerable people in their local communities, and how staff have been working tirelessly to keep services running. However, I understand that the past few weeks have also been challenging, and that community pharmacies are seeing unprecedented demand. The sector has well and truly risen to this challenge, and I know that in Westminster and beyond, there is a real appreciation for the work that you do. So please accept my thanks and those of the whole government for the outstanding service that your teams have delivered. He goes on to talk about the funding in England, which was of course announced earlier this week. And to be clear, that's just an advance, not funding a COVID payment to cope with the actual costs of the crisis. And then Matt finishes by saying, I know that you're in regular dialogue with my colleague Joe Churchill, who's the pharmacy minister here for England. Please keep sending your views to Joe and I so that we can make sure that our brilliant pharmacies are getting the support they deserve. So please keep an eye out for our daily emails with all the latest information about the virus, community pharmacy and the wider picture. We're also maintaining a website hub, an information hub, which you can find on the homepage. Today, all of us in the NPA team are really proud to serve you, the members of the NPA, as you serve the nation. Thank you.